I'm going to read out a comment that was shared by one of our readers on the Daily Nation, and who shared their opinion on some of these issues, called Pansela Wawira from Kakamega. She says, at schools and other institutions that serve food have a responsibility to ensure that it is fit for human consumption. That includes proper preparation, storage and handling of food, as well as regular inspections to identify and address risks. The food must be cooked thoroughly and served in a clean environment, but also parents and students must also take responsibility for their health and well-being by taking steps to reduce poisoning risks. The incident resulted in the abrupt closure of the school to protect the other students. So that calls for proper sanitation and the protection of food. So, Dr. Teresa, when we're talking about food poisoning, how bad is it? How serious is food poisoning? Is it like, okay, of course we've seen it's life-threatening because we've seen people who've lost their lives, students, but tell us how important it is to be educated on the importance of food safety.
I think that's a very important thing, and as Catherine alluded to, we have a school policy which has stipulated guidelines on who should get the training and what should be done, both by the schools and also by the community. I think first thing is to really educate the cooks, the food handlers, because we've talked about it may not be easy to inspect the food that is delivered to the schools, but the food handlers usually should have an inspection certificate, for the food handling certificate, which of course has a cost attached to it, which the school may not be able to bear, and this would be one of the things that school alumni can actually take, because if you have, especially even for the long-serving cooks, if you're able to, sometimes you just assume they are okay since they've been here long enough, but I think being able to get that regular habit of food handling certificate, so as the principal is checking who has paid fees, they also need to check who has the most recent certificate, and that is really important.
So
because
sometimes it's not just about the fact that the food was contaminated. The food might be just completely fine, but it depends on how that food was handled.
Yes.
That's what you're saying.
Yes. And I think it's one thing that is really easy to do, because it's all about awareness. We have the public health offices that provide the service, and they can even be able to come to the school to take the samples. And for me, I don't know that you remember, much earlier there was the issue about typhoid Mary and even cholera, how cholera was discovered even in the UK. You really have just one source, and that could affect everyone in the community. And as public health specialists at the Public Health Society of Kenya, we really look into solutions, working with stakeholders, as Catherine has said, to be able to come up with solutions, because health economics is one of the aspects of public health. There's also the social aspects, and even allowing the community or even the school nurse to be able to deal with, to have some responders, to get some training on how to respond to food poisoning is really important, because it inevitably may happen, but how does the school, especially the school nurse, have they been trained to be an emergency responder, which is really a basic thing? Do they have the basic medicine to be able to deal with that? And even how are they able to follow up the chain? Most of the time you find that we don't expect some of these things to happen, and therefore we don't do training. So I think with the Ministry of Health, working together with the Ministry of Education, we should be able to train nurses on being fast responders. But also within the students' community, we can actually come up with champions for cleanliness. There are many wash programs working in the community, but they really focus on the ASAL and the places where there's not enough water and sanitation. But they have a role, because a school is a captive community. They are not going anywhere. They are there for several months, as Catherine said. Children spend more time in school than they spend at home. So I really want to challenge the NGOs working in WASH to be able to pick up the schools as one of their objectives. And even most of the corporate organizations, they do a lot of CSRs. They help in expanding the school, but more important, they can actually focus on food safety and also training. Because I believe that if students take up the responsibility, they would actually be able to work within themselves, to be able to police themselves, to ensure that there's safety.
Right. Catherine, I see you agree with the fact that we actually need more training. And